walnut-sized prostate gland is situated just beneath the bladder and encircles the upper part of the urethra. It secretes alkaline fluid rich in enzymes and prostaglandins. This secretion is important to the survival and performance of the sperm. The aging male is prone to develop enlargement of the prostate, known as benign prostatic hyperplasia, or BPH. The prostate contains numerous small glands which secrete into the urethra, and muscle fibers and connective tissue. In benign prostatic hyperplasia, all of these elements increase, resulting in enlargement of the prostate gland. The first changes in BPH involve proliferation of glandular tissue in the area known as the transitional zone. This is the area immediately surrounding the urethra. As the prostate enlarges, it compresses and distorts that part of the urethra which passes through it, causing disruption to the normal flow of urine. Benign prostatic hyperplasia may cause lower urinary tract symptoms, or LUTS. These include problems with voiding, such as hesitating and starting to urinate, a reduction in the stream, a feeling that the bladder has not completely emptied with urination, and dribbling after urination. Nocturia, or increased frequency of urination at night, causing the person to get up more than once during the night, is another common symptom and may seriously interfere with sleep. Sometimes, despite frequent urination, the bladder may not empty completely, causing a large post-void residual urinary problem. This situation requires intervention to avoid problems associated with urinary retention, such as increased risk of infection, bladder stone formation, or cancer development. There may also develop storage problems due to irritation of muscles of the bladder wall and muscles surrounding the proximal urethra, causing the person to urinate more frequently.
To relieve you and your symptoms, your doctor feels that you would benefit from a surgical procedure called TURP. TURP is designed to relieve symptoms by reducing the size of the prostate. It is also a diagnostic procedure. Tissue removed during a resection of the prostate, or TURP, is routinely screened for the presence of cancer. Your doctor will then lift your penis upward. A well-lubricated instrument called a resectoscope is then gently inserted into the urethra. When the resectoscope reaches the back of the penis, your doctor will pull the penis downward in order to create a straight path into the prostate. Once the instrument is inside the prostate, your doctor will extend a small loop of sharp-edged wire from the end of the resectoscope. Using this tool, your doctor will then scrape excess tissue from the prostate, restoring it to its normal size. Tissue removed from the prostate may be sent to a laboratory for analysis. When the surgery is complete, your doctor will remove the resectoscope. Your doctor will probably ask you to wear a temporary Foley catheter. A Foley catheter is a narrow tube inserted through your urethra and into your bladder. The catheter is connected to a bag that is attached to your leg by a strap. While the Foley catheter is in place, urine will pass from your bladder into the bag. You will not need to urinate into a toilet. The nurse will show you how to change the bag when it's full. An appointment will be made for you to return to the doctor's office in a couple of days to have the catheter removed. As soon as the anesthesia wears off and you feel comfortable, you will be allowed to leave.